So today's day 14 of documenting the journey from hair loss to hair restoration, from shedding, thinning to stabilization, thickening hair, providing more hair. So there's a lot of different things that we do here in my office. So today we performed a robotic FUE procedure. This patient previously had a procedure elsewhere to the frontal region. We're filling in more to the top crown area, harvesting about 1,400 grafts to fill in that area. You have to anticipate that there may be more hair loss down the road in the future, so the plan needs to take that into consideration, the density where you're transplanting the hair. Maybe you don't fill the crown as dense because there may be more hair loss there in the future that you may need to address, and you want to preserve donor hair availability for down the road as well. Also important to discuss medical treatments with the patient to help to stabilize their hair, such as finasteride, minoxidil, PRP, all very good treatments. But to discuss them, discuss the risks, side effects, potential benefits as well. So in addition to the procedure, we saw patients who had previously had procedures, came in for their yearly follow-up, great outcomes, great growth. We saw several PRP patients. Our PRP patients, in the beginning, we do 3 treatments spread apart by 6 weeks, and then we evaluate at 6 months. A lot of our patients have gone through that, had great results, and they're coming in every 6 months for their maintenance. So we saw those patients as well. Also did some new consultations. Saw someone who was a female, not a very good transplant candidate, diffuse thinning, diffuse crown thinning, better for medical treatment, so scheduled for PRP. Discussed the minoxidil as well. Discussed vitamins can help. Some people use Nutrafol or Viviscal. There's topical botanicals that can help to strengthen hair as well. I think those are best used in conjunction with some of the other treatments like minoxidil and PRP. And also some male patients who had thinning and receding at the hairline. Discussed robotic FUE procedures. Why I think the robotic method is more beneficial than the manual FUE method for harvesting of the grafts. I explained that the site making, the implantation is done manually by hand. The site making is all done in my hands. I think that's the aesthetics of the procedure. So that's the best way of doing it in my opinion. So it was a great day, a lot of patients, a lot of great outcomes. So that was a day in my office today.